In this lecture we are gonna study on drugs for hyperlipidemia. Let's start easy. Hyperlipidemia is the condition in which an abnormally high levels of lipids are seen in bloodstream. They adhere completely to walls of arteries and blood flow starts getting obstructed, gradually leading to CADs like heart attack and stroke. There are three major lipids in the blood: cholesterol, triglycerides and phospholipids. Cholesterols are precursor for the synthesis of steroid hormones like estrogen, progesterone, etc. Triglycerides composed of glycerol and 3 fatty acids, and phospholipids being major component of cell membrane. Lipids are insoluble in blood and transported via lipoproteins. Lipoproteins composed of a hydrophobic core and a hydrophilic outer coating. Cholesterol and triglycerides transported through the hydrophobic core, which are highly soluble for them. There are 4 major lipoproteins based on density: chylomicrons, very low-density lipoproteins, low-density lipoproteins and high-density lipoproteins. When abnormally high levels of LDL are present, it accumulate in the inner wall of artery leading to atherosclerotic lesions. Hence LDLs are bad, while high-density lipoproteins suppress LDL oxidation and prevention atherosclerotic lesions to a certain extent. Here is the classification of hyperlipidemic drugs, and let's see one by one. Let's move on to first class HMG-CoA reductase inhibitors. Cholesterol biosynthesis takes place in the liver by mevalonate pathway. The rate-limiting step in this reaction is the conversion of HMG-CoA enzyme A to mevalonate and is driven by HMG-CoA reductase. Statins inhibits this enzyme, leading to reduced cholesterol synthesis. As a compensatory mechanism, there will be upregulation of LDL receptors, decreased secretion of VLDL and increase in HDL, thus handling the hyperlipidemic condition. Drugs in this class are atorvastatin, simvastatin, pravastatin, rosuvastatin, lovastatin, etc. All drugs in this class are well tolerated, since they are metabolized by liver. Elevation in serum transaminase are seen. Myopathy, rhabdomyolysis are serious but rare side effects. Fibrates. This class of drugs are otherwise called lipoprotein lipase activators or PPAR-alpha agonists. They are named so because of their mechanism of action. Fibrates activate PPAR-alpha, that is peroxisome proliferator activated receptor alpha, that regulate gene transcription regulating receptors in the liver. They in turn activate lipoprotein lipase and promote a series of actions such as lowering triglycerides, improve fatty acid oxidation, increased HDL, and reduce VLDL and chylomicrons. Drugs in this class include gemfibrozil, fenofibrate, bezafibrate. Epigastric distress, loose stool, skin rashes, impotence, blurred vision are common side effects. Next class of drug is bile acid sequestrants. They are also called bile acid resins. They are basic ion exchange resins applied in the form of chloride salts. They are neither digested nor absorbed in gut. They bind to bile salts and prevent enterohepatic cycling of cholesterol, which are absorbed with the help of bile salt, thereby causing fecal excretion of both bile salts and cholesterol. Resins retard atherosclerosis and coronary artery diseases, but they are clinically less popular as they are unpalatable and cause flatulence and other gastrointestinal symptoms. Lipolysis and triglycerides synthesis inhibitors. The major drug in this class is nicotinic acid, aka niacin. It's a group B vitamin which upon higher doses reduce plasma lipids. Niacin blocks lipolysis in adipose tissue and thereby reduced formation of fatty acids. These fatty acids act as precursor for the synthesis of VLDL in liver. Since LDL is synthesized from VLDL, decreased production of VLDL in liver leads to lowered levels of LDL in plasma concentration. Niacin also increase the plasma HDL concentration. Therapeutic doses of niacin are large and are poorly tolerated. Cutaneous vasodilation, flushing, itching and redness. Dyspepsia, which leads to peptic ulcer, are major side effects. Long-term use causes serious liver damage, jaundice, hyperglycemia, hyperuricemia, gout, arrhythmias, and niacin is contraindicated in pregnancy and in children. Therapeutic uses are hypertriglyceridemia, in combination with statins for prophylaxis of secondary as well as primary cardiovascular disorders. Niacin is mostly important in the treatment of pancreatitis association with severe hypertriglyceridemia. Because it's highly potent, its use is restricted to severe cases only. Stool absorption inhibitors, as timib is a novel drug and it acts by blocking the intestinal absorption of dietary and biliary cholesterols. This leads to decreased transport of intestinal cholesterol to liver, finally causing increased clearance from intestine rather than transport and storing in liver. As timib is usually administered in combination with a low-dose statin and can cause considerable lowering of LDL. This regimen is contraindicated for moderate to severe hepatic insufficiency. Omega-3 fatty acids. They are polyunsaturated fatty acids, in which eisopentanoic acid and docosahexaenoic acid are major components. They inhibit VLDL and triglyceride synthesis and also enhances HDL levels. They are obtained from marine fishes like tuna, salmon etc. They are dietary supplements, as omega-3 fatty acids are difficult to obtain from diet. Adverse effects include abdominal discomfort and persisting pungent fishy taste. Very high levels of plasma cholesterol is the major risk factor for coronary artery diseases and stroke. Lowering the LDL levels can decrease cardiovascular morbidity and mortality. All patients who are at greater risk of CAD and stroke are usually prescribed to administer prophylactic aspirin doses, and based on the lipid profile of the patient, other hypolipidemic drugs are prescribed. With this, I'm gonna conclude this video, and feel free to comment your thoughts, and stay tuned.